There's a very old drug called metformin. It came out in 1955. So I take metformin just preventatively, and I give metformin to a lot of my patients with cancer and that are interested in wellness that are over 50. And the reason is it originally came from the French lilac. It had been used in European folk medicine for about 300 years before. They noticed that there was 40% less cancer over the ensuing decades in people taking metformin compared with those that weren't. And then there was a fascinating study published 3 years in the Journal of Clinical Oncology and breast cancer. They wanted to look at diabetic women with very large breast tumors that had to get chemotherapy to try and shrink it down to make it operable. And some of the women were on insulin, some were on the newer drugs, Actos, Januvia, some were on metformin. So they just wanted to see how diabetic women did with this type of chemotherapy. To their surprise, they found that there was a threefold increased incidence of complete remission, meaning when they went in to do the surgery, there was no cancer at all, even under the microscope, in the women that were taking metformin. We're seeing the same thing in men with prostate cancer now, even after it's already developed. It's becoming almost routine to put these people on metformin. Metformin will lower your insulin-like growth factor. It increases insulin sensitivity, but it does something even more powerful. It turns on a host of tumor suppressor genes. So this is an example of a very old drug that's off patent, that people can't really make any money on anymore, that very few people know about, when the scientific literature is so strong in support of using it both for cancer prevention and treatment. Exercise, absolutely critical. There's a hormone released from your muscles after heavy exercise called irisin, and that's been associated with anti-aging. It's been associated with what's called longer telomere length, which has to do with the length of your DNA strands. So exercise is one of the most important things you can do to improve insulin control, glucose control, anti-aging, and anti-cancer is as important as any food. And the precautionary principle, Deborah and I have written papers on this. It came from Richard Horton, editor-in-chief of Lancet, and I just want to read this because it's so important for all the work that Environmental Health Trust is doing right now, and it's been important for all the work that I've been doing over the last 25 years, and it says, "We must act on facts and the most accurate interpretation of them using the best scientific information. That does not mean we must sit back and wait until we have 100% evidence about everything." So, that's what, a lot of the polluters, like even, with DDT, and I could name a number of at least a dozen other things that were proven to be carcinogens, but only, the chemical industry wanted to demand 100% prove that it's harmful. And, with the precautionary principle is saying is prove that it's safe where the state of health of the people is at stake. The risk can be so high and the cost of corrective action so great that prevention is better than cure. And then where there are significant risks of damage to the public health, we should be prepared to take action to diminish those risks, even when the scientific knowledge is not conclusive, if the balance of likely costs and benefits justifies it. You'll have people tell you, well, you have to have 100% evidence. If you wait for proof of harm, most often it's going to be too late. And these are just some of the websites for the speakers tonight. And I'd like to just close by giving you a little analogy. We all fasten our seatbelts before we drive our car to avoid fatal auto accidents. We brush our teeth to prevent tooth decay. I hope I've given you enough information now to see that there are a number of steps we can all take to prevent ever developing cancer. Thank you.